Hi, good morning to everyone. Subscribers and future subscribers of Health and General Information Channel. Gerald is here again for another piece of information regarding rabies that we will discuss and talk about. Before that, please finish to the end, and at the end I have a question. Just comment your answer with your name so that you can participate in our annual raffle promo. Let's get started. Rabies in dogs is caused by a virus called the rabies virus. This virus is transmitted through the saliva of infected animals, usually through a bite. Once the virus enters the dog's body, it travels to the nervous system, where it causes inflammation and damage. Symptoms of rabies in dogs may include fever, aggression, confusion, excessive drooling, difficulty swallowing, paralysis, and seizures. If left untreated, rabies can be fatal. The treatment for rabies in dogs typically involves a series of vaccinations to prevent the virus from spreading further in the dog's body. If a dog has been bitten by a potentially rabid animal, the dog should be immediately taken to a veterinarian for evaluation and treatment. Prevention of rabies in dogs involves vaccination against the virus. It is recommended that dogs receive the rabies vaccine as part of their routine healthcare, starting at around 3 to 4 months of age, and receiving boosters regularly throughout their lives. Additionally, it is important to keep dogs away from wild animals and to supervise them closely when outdoors. Here is a more detailed explanation of dog rabies, its causes, symptoms, and treatment options. Rabies is a viral disease that affects the nervous system of mammals, including dogs. The disease is caused by the rabies virus, which is transmitted through the saliva of infected animals, usually through a bite. Once the virus enters the body of a dog, it travels to the brain and spinal cord, where it causes inflammation and damage. The symptoms of rabies in dogs can vary depending on the stage of the disease. The first stage, known as the prodromal stage, can last for 2 to 3 days and is characterized by mild behavioral changes, such as anxiety, restlessness, and fever. The second stage, known as the furious stage, can last for 2 to 4 days and is characterized by aggressive behavior, excessive drooling, and difficulty swallowing. The final stage, known as the paralytic stage, can last for 2 to 4 days and is characterized by paralysis of the hind legs, throat, and jaw. If left untreated, rabies can be fatal in dogs. However, there is an effective treatment available known as post-exposure prophylaxis, PEP. PEP involves a series of vaccinations that are given to the dog to prevent the virus from spreading further in the body. The vaccine works by triggering the dog's immune system to produce antibodies that can fight off the virus. The first step in treating a dog for rabies is to determine whether the dog has been exposed to the virus. If the dog has been bitten by a potentially rabid animal, it is important to take the dog to a veterinarian for evaluation and treatment. The veterinarian will assess the dog's condition and determine whether PEP is necessary. Prevention is key when it comes to rabies in dogs. The best way to prevent rabies is to vaccinate your dog against the virus. It is recommended that dogs receive the rabies vaccine as part of their routine healthcare, starting at around 3 to 4 months of age, and receiving boosters regularly throughout their lives. Additionally, it is important to keep dogs away from wild animals and to supervise them closely when outdoors. In conclusion, rabies is a serious disease that can be fatal if left untreated. However, with prompt treatment and prevention measures such as vaccination and supervision, rabies can be effectively managed in dogs. If this channel is helpful to everyone, if your answer is yes, can you share this video, consider subscribe and click the bell icon. Your simple viewing, sharing and subscribing is a big help for our small communities and the rural areas of the Philippines that we help. Thank you.